Alzheimer's can be a really difficult diagnosis, not only for the person affected by Alzheimer's, but also the family members around them. Sharing one of my own stories, my grandmother was diagnosed with Alzheimer's quite a few years back. The family members around her noticed that her short-term memory was going. She was forgetting about things that she had eaten for the day, where she had been, and that's quite distressing for the family members because they know the events that have happened, but clearly the mum hasn't. This has started progressing over time. Grandma's memory about past events started fading, and even she started to lose a memory about people that she's met in her life. Unfortunately, she suffered a fall and she managed to break her hip, and she was in a rehabilitation center, and this is where a lot of her memory declined significantly quicker. I remember my mum saying that when she went to see my grandma, that there were times that she actually forgot who my mum was, and it broke her heart because the person, her mum, who she has known all her life, has now in some ways forgotten about her. So what is dementia and Alzheimer's? Dementia is a condition which causes a decrease in the functioning of your brain, including your memory. Alzheimer's is the leading cause of dementia, and not only can it impact your memory but also your functioning, so things like how you speak to even how you mobilize and do things like go to the bathroom. The cause for Alzheimer's is not truly understood in detail, but there are some risk factors such as increasing in age, getting older, having a family history of Alzheimer's, and also things that affect your general health, so having high blood pressure, having a high cholesterol, living a sedentary life, so not getting enough exercise or mobility. Also things like smoking and excess alcohol consumption can increase your risk of developing dementia and Alzheimer's. So what are the signs and symptoms of Alzheimer's and dementia? The disease process can actually start many years before the symptoms show themselves, and often the symptoms can be quite subtle, so the person's functioning might not necessarily impact the daily life so much. Some of the main signs and symptoms that you will see is memory loss that affects the daily life, so forgetting names of people, places, forgetting where they were going. That can be a very common one that's quite easy for family and friends to pick up on. 2 is changes in their ability to deal with problems, or problem solving. So if the person in question was normally good at looking after their finances, they may now struggle, or simply planning what to have for dinner can be a struggle for someone with dementia or Alzheimer's. 3, personality changes is a big one in dementia, and sometimes an aspect that's fairly poorly understood. Someone with Alzheimer's or dementia will have a decline in the functioning of their brain, and this can include their mood centers. So the condition, as it progresses, may cause a change in their mood. They might become more irritable, more angry, sometimes depressed, and they can even develop behaviors like becoming suspicious of others around them. But also it can be a consequence of the symptoms that they're suffering from within Alzheimer's or dementia. So for instance, if they're forgetting names and places, that can be very frustrating. Think of yourself. If you're struggling to remember a name of something that was very familiar to you, it can be really frustrating and put you on edge. But imagine someone with Alzheimer's having a whole day like that. That would inevitably have a big impact on their mood and their irritability levels. Number 4, their ability to speak and talk can change radically. So when they're having a conversation, they might find it very difficult to complete the sentence or think of a word to add into the sentence. They may even stop halfway through the sentence as well. The other aspect about talking and speaking is their language centers can be impacted. So when you are having a conversation with someone with Alzheimer's, you might find that they don't understand what you're saying, even though you're speaking in very simple language, and that's a part of the disease process. Number 5 can impact mobility and functioning of the body. You might find that they're moving less and less over time. It can also impact the normal bodily functions like going to the bathroom. They might lose control of able to pass urine, and even passing stools can be something that they lose control of, which can be very distressful and really impact their dignity. What to expect when someone receives a diagnosis of Alzheimer's? You may find that the person receiving the diagnosis is often shocked because they're not actually aware that they're losing their memory. And sometimes these patients can go through stages of grief when they receive this diagnosis. So that starts off with denial. They don't think they actually have the problem. Then they have anger. They get quite angry about what the diagnosis that they have, especially if they still have their level of understanding and they're able to understand that it's a disease that progresses even further. So you might see that feed into their personality. You might see some bargaining. They might say, look, what if I, try and do a few things? Is there a chance that I might be able to reverse some of this problem that I'm having. It's a way the brain tries to rationalize and try to improve their outcomes. Eventually, they'll go to the next stage, which is depression. So it can have a big change in their happiness levels. You can find that they're less interested in doing things. Their mood is low, and it's a challenge to get them up and out and get them to do the things that they once enjoyed. The final stage of grief is acceptance. But acceptance would be to understand that they have this diagnosis and understand that it's going to continue to decline, which is a very difficult thing for us to kind of comprehend. What is the speed of decline of Alzheimer's or dementia? Now, this is a difficult question to answer because it's all individualistic. For instance, if a person has had poor lifestyle choices, they're overweight, or lifestyle choices that increase their risks, such as heavy smoking, alcohol consumption, not moving around much, not getting much exercise, they could have a faster decline. Can you slow down Alzheimer's or dementia? There isn't a cure for dementia or Alzheimer's. However, there are factors that you can consider that will help reduce the speed of decline with this condition. One is cognitive behavioral therapy, or cognitive rehabilitation, which allows a person to understand their problems and also to make sense of it better, which can be really advantageous in their progress. Managing other conditions that can lead into dementia can be really important to get on top of to help reduce the speed of decline. So if they have hearing problems or visual problems, for instance, it's important to deal with these very early so that they can keep these senses intact and this won't confuse the overall dementia picture. This also extends to other problems, like if you're in significant pain or you have other conditions that are causing symptoms on a daily basis. It's important to try and tackle these so they don't complicate the overall picture for a patient with dementia or Alzheimer's. There are some medicines too. However, this is only usually prescribed once you've been referred to an old age psychiatry clinic, and they often have something called a memory clinic, which you can be referred to once you've had an official diagnosis and you've had some blood tests and an ECG test too. One aspect that is often underlooked, it's important to try and keep as much of the home environment intact as possible. Making radical changes or even small changes can really disorientate the patient with dementia or Alzheimer's. If you remember that the short-term memory is already affected, if you then cause changes within the room, simply changing the color of the walls or rearranging cabinets, it can impact the long-term memory, which can make it very difficult for them to understand and place themselves in the room. Are there any other conditions that mimic Alzheimer's? Yes, there are, and often when you see a clinician for the first time, they will aim to work through these to ensure we can rule them out before you get a diagnosis of Alzheimer's. So what are these conditions? So it could be an infection. So if someone, for instance, has a urinary tract infection, it can cause them to impact their memory, especially if they're older, and even affect their mobility. So those two things can be confused for Alzheimer's. Having a head injury can cause very similar symptoms, concussion, and rarer conditions such as neurological conditions can also mimic Alzheimer's. One can be multiple sclerosis. What support is there available for someone who's suffering from Alzheimer's and dementia? So you have Age UK, Dementia and Alzheimer charities, which have lots of resources local to where you are. They can put you in touch with support services and even respite care that can help you on a day-to-day. Respite care is very important for the person with Alzheimer's and also those who care for them. Having time for the carer to fill their own cup and recharge their batteries is essential, because you can't pour from an empty cup to help another person. You have to also have the time to look after yourself. Also, some areas will have certain services such as dementia nurses that can come in, help support the person in question, help support the family, and also carry out yearly reviews to ensure we can slow down some of the decline in dementia and Alzheimer's. If you suspect someone has Alzheimer's, then it's very important that you contact your clinician. Often the person in question isn't aware, so when going to the GP, it's important that you have someone with the patient, a family member or a loved one that understands the patient and knows them very well. The reason for this is the person in question may not be aware of all the symptoms that they're experiencing, and the loved one can give a collateral history that will really help the clinician understand the nature of the problem. The GP is likely to do a number of things when assessing someone with memory loss. The first is carrying out a memory test, so asking a series of questions and asking the person to write and draw some items down. This will go into a scoring tool and help risk stratify your chances of having a problem like dementia. They would also rule out causes of infection, such as a urinary tract infection or anything else that can contribute to memory loss. They would also do a series of blood tests and ECG to rule out deficiencies or cardiac causes of memory loss. Once this is done and they have all the information together, the GP can then refer you to a memory clinic so that you have an assessment from an old age psychiatrist who can then potentially consider medications that can slow down the rate of decline. We understand that a diagnosis of Alzheimer's or dementia can be really distressing. However, I hope you can see that there are support services available, so it's really important that you reach out to your clinicians to get that help. If you want to see one of our recent videos on weight loss, please click above here. Thank you for watching, and please do share with family.